What are the risks for accessing your medical records? Well, we started as a small pilot, a service within the practice back in 2003, where we were offering some patients a copy on disc of their full medical record. This was a project that we did with UMIST and another practice called Hadfield Medical Centre over in Hadfield. It was a very successful project, and the findings were discussed at a European conference where many different clinicians, managers and so on were very interested in what we'd managed to achieve. Essentially, we'd managed to find a way for patients to be able to see their electronic records safely away from the practice. Subsequently, we developed the system further to the point where we can now offer it so that patients can see their medical records in real time over the internet. And we've decided to move this away from a project, away from a research study, to a mainstream service that we're now offering all our patients within the practice. We don't know whether this is safe or not, and whether there are going to be any problems. However, we do have a fair amount of experience that shows this can be done safely. Sometimes there are glitches in the system, and of course we're always dependent on the internet, whether it's working or not, and that can sometimes be a problem. There is of course the issue about passwords. The safety and security of your medical record is dependent upon you making sure that you keep your passwords safe and don't let anybody else see them. That means no other friends, no other family members, and no staff, if that's what you want. Of course, we also are concerned that if lots of people register online, start looking at their medical records, and then if everybody wants to suddenly start asking a lot of questions, the practice may become inundated with requests, and this may put further pressure upon the practice, especially when we're under a lot of pressure at the moment. Our experience to date hasn't been like this. Most patients have looked at their records and found everything to be as it should be, and there hasn't been a huge pressure. But we would like to point out that if there are problems that you find with your own medical record, be patient and inform us about it, and give us time so that we can look into things and get back to you. The internet isn't always reliable, as I mentioned earlier, and there are times when you try to log on and find that it won't let you see your medical record. Sometimes that might be a problem at our end with the server in the surgery, or it might be a problem with a server on the internet itself, or it may be a problem at your end. There's all sorts of reasons why you might not be able to access your medical record at a particular time, and it's important that you recognise that. I mentioned earlier that we did this on the back of some research that we did back in 2003. In order for the research to get through ethics committee approval, there were 3 groups of people who were particularly excluded from the research. These 3 groups included those with mental health problems, children below the age of 18, and anyone who did not speak English as their primary language. As I mentioned, this has now moved away from a research project and is now mainstream, and we're now offering this service to all our patients, including those 3 groups, those with mental health problems, children and foreign speaking people. Of course, we don't know whether there are any particular issues with these 3 groups of people, and so it's important to bear this in mind, particularly if you fit into one of these 3 groups. If you have any doubts and are not sure whether records access is for you or not, then please get in touch with your doctor or nurse within the practice so that you can talk it through further. We want to help you, and we want to try and ensure that you maximise the benefits and minimise any harm from this service.